Hello everyone and welcome to your first educational presentation as part of your 90-day back pain programme. So my name's John and I'm a physiotherapist, and for today's short presentation I'll be talking a bit about the background of back pain and touching up onto some of the facts, figures, myths and jargon around back pain. So one of the most common questions I get asked in clinic from a back pain sufferer is what's at fault here? And rightly so. If someone came in with a painful ankle, they'd want to know whether they had sprained it, got plantar fasciitis, or maybe arthritis, as the unknown cause of our pain can lead to fear of the unknown. So let me break down the reasons for back pain in percentages. This diagram very neatly breaks down the common reasons of why we suffer from back pain. 1% of back pain is due to sinister reasons such as fractures or cancer. 9% is due to specific structures which are at fault, maybe a disc herniation causing sciatica. However, the remaining 90% comes under the umbrella term of non-specific back pain, and you may have heard this term as mechanical back pain or the poorly worded term simple back pain, as it's far from it. But coming back to this term of non-specific back pain, it is defined as pain not due to a recognisable specific injury or reason. There is no identifiable reason why this person's back is causing pain. So, great, we know that 99% of back pain is not due to anything sinister. That has eased some of my anxiety around my back pain, but if there's no recognisable or identifiable cause of why my back is causing pain, what on earth is going on? And this is the million-dollar question to answer, which sadly, for whatever reason, has been lost in translation in the majority of healthcare services. Back pain has been looked at in a tunnel vision manner without looking at the big picture, which is why back pain is such a prevalent and recurrent problem nowadays. And so, if there is no identifiable specific reason for back pain, then we must look further afield. And this is where the what's in your cup question comes into play. Like everything in life, it's about balance. From work to play to health and wealth, we must balance building our cup, the things that are good for you, to what's in your cup, the things that are harmful to you. And this is the very, very important notion in back pain, which will all be explained in much more detail in later weeks. And so, moving on to some facts and figures around back pain. 60% is a bit of a golden number in back pain, as 60% of adults at some point throughout their life will experience back pain, with incidence peaking in the ages of 40 to 50 years of age. And furthermore, 60% of these people will experience another episode of back pain in 3 to 6 months. So this really goes to show that back pain is a massively prevalent but also recurrent problem. And then moving on to the graph below, to move on to a bit of jargon busting, as you may have heard or seen these terms around back pain before. Now, being labelled as having chronic lower back pain is pretty scary. It makes you think of unstable, weak, easily damaged, which is very counterproductive but also simply untrue. The truth around these terms is that they simply relate to a time frame of how long you have had your symptoms for, and they actually delve no insight whatsoever into the severity or nature of your back pain. And then another common term given in back pain is called acute on chronic back pain. Now, this relates to someone with long-standing back pain who has episodes of recurrence maybe every few months when their back pain is particularly aggravated. This may be commonly referred to as having flare-ups. And so we've delved a bit into the time frames of back pain. Now let's look at the recovery times. So the standout point here is that 90% of people's back pain episodes fully resolve by 12 weeks, which is great news and sheds a lot of confidence into people who are several weeks in and think this is beyond relief now. And furthermore, looking at the bottom axis of this graph, by 2 weeks into a new episode of back pain, 50% of these people will fully recover, increasing to 70% at 4 weeks. So that's all great news, but there are 2 points here that need answering. One, why do these people get back pain in the first place? And two, what about the 10% who don't fully recover after this 12-week period? Well, firstly, as with all injuries and diseases, we are at risk of having them, whether this be back pain, stroke, or lung disease. The way we alter our risk is by our lifestyle choices. So for back pain, the more risk factors we adopt into our lifestyle, the increased likelihood there is of us suffering from back pain. And secondly, for the 10% who do not fully recover, this can be due to a whole host of reasons. As we've already discussed, back pain is scary, especially when the fear of the unknown is playing in the back of your mind. And for this person, they will be scared of sinister diseases. They will be fearful to move and exercise. They will lack confidence and avoid doing activities out of fear of causing damage to their body. They will avoid exercise, all of which over a 12-week period results in some pretty big changes in the body. We become tight, weak, stiff, fearful, overweight, stressed, and understandably and likely would develop mental health problems as a result. And this is exactly why learning about back pain is so vitally important. When it comes to health and wellness, knowledge is most definitely power. And the more you know about your body and what your body is going through, the better equipped you are to combat it. And so, as we've discussed, we know that the more risk factors we adopt into our lifestyle, the increased likelihood there is of us suffering from back pain. And hundreds of factors influence back pain, and these outlined here are just the tip of the iceberg. But let's imagine at the top of this staircase here is a happy, pain-free person. But then, for whatever reason, stress or depression takes foot, maybe from work or an event in someone's personal life. This can lead to weight gain, to sedentary behaviour, poor diet. Maybe they start smoking or increase their alcohol intake. And with each negative lifestyle factor, the more of these steps down the staircase we fall, coming ever closer to the onset of back pain. And most commonly, all it takes to knock us off that last step into back pain is an awkward movement, maybe twisting while putting on the seatbelt, bending down to pick something up from the floor, and like that you're in back pain. And as I'm sure many of you are aware, back pain leads to a vicious cycle of all these intertwined factors which can take any combination of recurrence. And now, as you progress through this course, you will learn much more about how our lifestyle, our social and work environment, and our activity levels, and our brain itself interacts with our back pain, and how it is a key part of your back pain treatment. Which is why we're including lots of bonus teaching throughout this 90-day program from our respective experts. And lastly, from my time as a physiotherapist, myths around injuries are something that are all too common, which I've seen firsthand make people directly avoid doing the things that would actually make them better and in less pain. Now, myths are really important to bust as they can halt and divert attention from the true management and treatment strategies in back pain, which just means more time suffering from back pain itself. And I can assure you there are some myths and a half out there on Google and social media. So I'm going to quickfire these myths with a brief description as to why. So firstly, persistent back pain can certainly be scary, but it is very rarely due to anything sinister or dangerous. Think back to that 1%. Secondly, old age is not a cause of back pain, although it is a widespread belief and concern that getting older causes or worsens back pain. The scientific research evidence does not support this, and evidence-based treatment can be effective at any age, whether that's 20 or 80. It's more about the lifestyle and health habits that are contributing to back pain, which just become more prevalent as we age. For example, as we age, we exercise less, or we tend to exercise less. We become more sedentary and generally put on excess weight. And this is commonly misinterpreted as the age itself causing the back pain. Thirdly, scans are unreliable in diagnosing back pain and are only helpful in a very, very small minority of people. Commonly, it's the 1% with this sinister disease which requires scans. So for the common types of back pain, scans are actually pretty pointless. The reason being is that lots of scary sounding things can be reported on scans, and if you've had one in the past before, I'm sure you have heard the phrases of disc bulges, degeneration, protrusions, and arthritis, and the list goes on. Unfortunately, however, these scans or the people explaining them sometimes fail to mention that these are very common findings in people without back pain, and that they fail to predict how much pain you feel or how severe your back pain actually is. Fourthly, pain doesn't equal tissue damage, and pain during exercise does not mean you are causing damage or harm to your body. When pain persists, it is common that the spine and surrounding muscles become really sensitive to touch and movement. The pain you are feeling during movement reflects how sensitive your structures are, and not actually how damaged they are. So it's safe and normal to feel some pain when you start to move and exercise, and this usually settles down with time as you get more active. In fact, exercise and movement are one of the most effective ways to treat your back pain. And on to the last two here: injections, strong drugs, pain medication, and surgery usually are not a cure, and every possible intervention should be thoroughly and persistently applied before even considering these more invasive measures. They should be an absolute last port of call, as these methods are not effective or are generally not effective in treating back pain in the long term, whereas the low-risk methods which we're systematically introducing into your exercise program and lifestyle are, and they are the ones that should be our first port of call. So we busted a few myths. Now let's run through the absolute key facts around back pain. So firstly, persistent back pain can be distressing, scary, and disabling, but extremely rarely sinister, as we've said. So we must learn to trust our back and start to reintroduce exercise and movement to achieve a healthy spine. After all, it was made to bend, rotate, and extend, and this is why we must ensure it does all of these things on a regular basis to keep it happy and healthy. If we don't use it, we lose it. Secondly, persistent back pain is rarely associated with serious tissue damage. So our backs are very strong. If you have had an injury, tissue healing 100% occurs within 3 months. So all types of muscle strains, ligament sprains, and bone fractures all heal within a 3-month period, every single one of them. So if pain persists past this time, it usually means that there are other contributing factors. A lot of back pain begins with no injury or with simple everyday movement, and these occasions may relate to stress, tension, fatigue, inactivity, or unaccustomed activity, such as a random burst of intense activity that is out of the norm for that individual person, which makes the back sensitive to movement and loading. Thirdly, back pain is not caused by poor posture. How we sit, stand, and bend does not cause back pain, even though these activities may be painful. A variety of postures is actually very healthy for the back. It is safe to relax during everyday tasks, such as sitting, bending, and it's even safe to lift with a round back. In fact, it's actually more efficient to do so. So when it comes to posture, it's not the posture that you are in which is the problem. It's the amount of time that you are in that posture for. So I always advise for people with back pain to spend no more than 30 minutes in one posture, as the best posture is your next one. So avoiding prolonged static postures and keeping moving is the best way forward. Fourthly, back pain is not caused by a weak core. So weak core muscles do not cause back pain. In fact, people with back pain often tense their core muscles as a protective response. This is like clenching your fist after you sprained your wrist. Being strong is important when you need the muscles around the core to switch on when we want to move, but being tense all of the time isn't helpful at all. Learning to relax the core muscles during everyday tasks can actually be very beneficial, and is something that we're going to touch upon in later presentations and exercise classes. Also, pain flare-ups, they do not mean that you are damaging your back. So while pain flare-ups can be very painful and scary, they are not usually related to tissue damage. So the common triggers are things like poor sleep, stress, tension, worries, low mood, inactivity, and that unaccustomed activity. And it's all about controlling these factors, which can help to prevent these exacerbations or flare-ups. And if you do have a pain flare-up, instead of treating it like an injury, the best way forward is to try to stay calm, relax, and keep moving and exercising with the exercise that you're able to do. And lastly, backs do not wear out with everyday loading and bending. In the same way that lifting weights makes muscles stronger, moving and loading make the back stronger and healthier. So activities like running, twisting, bending, and weightlifting are completely safe to do, even if you have back pain, providing you start gradually and practice regularly. So I hope you have found this presentation interesting and are starting to understand a little bit more of the background around back pain that you can build on in future presentations. I will be talking to you again in week 3, where I'll be discussing the evidence-based treatments of back pain, giving more detail around exercise, surgery, injections, pain medications, scans, and really dissecting why you, as a back pain sufferer, may have not improved despite engaging in previous physiotherapy and other treatment and management strategies. So over the next week of your short exercise classes, really try to take on board the information you've looked and listened to today to really start to feel confident in what your back can achieve. And I look forward to talking to you all again in week 3.